he walked in with a cane.
I could barely,
young guy.
I could barely move. I could the pain just walking with that cane was incredible. Maybe I could take 3 to 4 steps. I would have to stop. And then after the first day you did it, I was actually able to leave. I was able to walk. I was still using the cane, but by day 2, I didn't have it anymore.
Hello everyone, Dr. Dave here with Synergy Wellness, Chiropractic and Physical Therapy in New York City. We've got Steve here. I really regret this too. We should have filmed him from the second he walked in, but how weird would that be? A new patient coming in and I'm filming him as he walks in, barely walks in.
Right.
I mean, he walked in with a cane, young guy.
I could barely move. I could the pain just walking with that cane was incredible. Maybe I could take 3 to 4 steps. I would have to stop. And then after the first day you did it, I was actually able to leave. I was able to walk. I was still using the cane, but by day 2, I didn't have it anymore. And my only regret is I wasted 2 weeks. I went to my regular doctor. He just gave me all these medicine. He gave me muscle relaxer and ibuprofen. Said take those for 2 weeks. And I did. Nothing changed. It just got worse. So then that's when she recommended I come see you.
Okay.
And,
did he give you any painkillers also?
Yeah, he did give me painkillers. I didn't take those.
Like heavy narcotics?
Yeah,
or?
it was one of the oxy things.
Okay, so there you go. He skipped that. The first time he said I got muscle relaxers and anti-inflammatories, but he didn't add in there he got narcotics.
Right.
Why? Why do they keep doing this? Why do they keep giving? Did that doctor ask you if you had a drug problem?
No.
This drives me crazy. Absolutely crazy. No questions about the past as drug addiction or nothing before prescribing this. And you always prescribe conservative therapy first before you do that. The muscle relaxers, anti-inflammatories, okay, but the narcotics, the pain relievers, I'm just so against that. And personally, I would.
I mean, I personally didn't take it because of everybody else I've heard that it ruins their life. They become addicted to the oxy, and that's all they care about anymore. That's personally why I didn't take it. I didn't want to take that chance.
Yeah, there's a high risk, but somebody that has a past addiction might fill that prescription and take it and go into a spiral.
Right.
And we're going to reach out to that doctor. He's going to get a letter from me, not a nasty letter, but he's going to get a letter educating him on what we do. As a physician, you need to know what every other physician, what every other specialty does out there. And if you don't, shame on you. Okay? Sometimes doctors get it wrong. They don't refer you to the right person. Okay? It happens. But this is a big no-no. In this day and age, he should not be prescribing painkillers, regardless of whether he has a past addiction or not. That is not the first thing you go to.
Right. I know that now.
Well, so and it was amazing. He was in here walking in a cane in so much pain. He left with the cane, but walking much better.
Oh, yeah.
And then the next morning he came back to see me and he walked in. Did you have the cane the second day? So the next morning he didn't even have the cane. Night and day difference. I
never normally walk with the cane. I only had it because of the pain day I was feeling.
Yeah. It was on a 20 on a scale of 1 to 10, the pain.
Right.
Now where are you at on pain level scale in your lower back?
Lower back, 1. You know, I'm really low. Yeah.
Great. All right.
And
let's have you lay down. What's that?
I think this is my
4th week.
4th week. So 2 days a week.
Yeah, and your pain was pretty much
off the charts.
Completely gone within a couple of visits.
Yes.
Now we're working on his posture, so this doesn't come back. So it's great that we got him out of pain, and all his trigger points are better, but we want to make sure this problem doesn't come back. So we're working with him on his posture, and you can see here still his right leg is short. So we're definitely going to correct that before that, becomes a problem and does become symptomatic. And sometimes I put him on his side. Sometimes I'll use this technique. Both techniques work great. This is Thompson technique. that. See that?
Mhm.
Now
Wow.
it's balanced.
Very dramatic.
When I first saw him, he was very difficult to adjust. His whole back was in spasm. Now it's just through here, mainly. Which, how are you doing, by the way, with your foam roller exercises?
I try to do it twice a day
Okay.
for about a minute or two.
Okay. Go ahead, take a deep breath in. And blow all the way out. Good. And again, deep breath in, bend the knees. And blow out. Good. All right. Lower your legs. So you'll see here he's got round bruises here on his back. It's because we did cupping on him last time. We're not going to do it again today. I want this to heal up a little bit more. So next week we'll do another session here in the mid back. That was helpful for you?
It was extremely helpful. It
Okay.
looks painful, but there's no pain at all on my back.
Yeah.
The pain was before we did the thing, where it was all tight and
Mm-hmm. Turn over on your back. Yeah, cupping feels like somebody's sticking a vacuum cleaner into your skin, right?
right.
But the back feels really loose afterwards,
Absolutely.
right?
Immediately.
Yeah.
Yeah.
Okay, cross your arms in front of you. And tuck your chin, take a deep breath in. Good, and blow all the way out. Good. Great, and another deep breath in. And blow out. All right. Hands up in the air. And how are you doing with the stretch in the doorway, with the elbow in the doorway?
That one, I might have to have you show me again.
Okay. So I'm going to show you all at the end of this a stretch that you would do if you sit in front of a computer and you have shoulders that roll forward. It's called upper cross syndrome, which he has. Relax here. Okay, let's have you stand up. So this is a great stretch. You're going to put, and I'll show you here on this corner, you're just going to put your elbow at shoulder height and step forward, and you're going to stretch the pec muscle, the chest muscle.
Okay.
And then after a minute, you're going to raise the arm up a couple inches, and you're going to do the same stretch. And you're going to stretch right underneath. You'll feel it a little bit more under your armpit. That's the pec minor, or the pectoralis minor muscle.
Okay.
Go ahead and try that. Step into it. You should feel the stretch
Oh,
across
yeah.
here. You feel that?
And then
Breathe in and out. Hold that for a minute.
raise up.
Yep. There you go. And lean forward. Good. You feel it more under the armpit.
Oh yeah.
That's the pec minor, which pulls the shoulders forward and down. So that's going to counteract that forward head rolled shoulder posture that you have.
That feels pretty good.
Try the other side. See if it's tighter. Yeah.
Yeah, this side's tighter.
This side's tighter.
Yeah.
Okay. You can do that in the door jamb, corner of a wall, wherever. I'd like you to do that throughout the day. Okay?
Awesome. Thank you so
All
much.
right, you guys are all set.
I love it.
Thanks for
See you
tuning
next
in,
week.
everyone.
Yeah.